All right, let's dive right in. Today, we're talking about something that affects a ton of pregnancies, but often flies under the radar. It's called maternal anemia, and it's this kind of hidden strain that's really important to understand for a healthy pregnancy. And it all starts with a question I'm sure many of you have asked.
You know that pregnancy fatigue, right? That exhaustion that feels like it's in your bones? But what if it's not just the normal side effect of growing a tiny human? Sometimes that deep, profound tiredness is actually your body's way of sending up a flare, signaling that something else is going on. And that something is often anemia.
So, what is it exactly? Well, think of it as an oxygen delivery problem. Your body, and super importantly, your baby, count on red blood cells to ferry oxygen everywhere it needs to go. When you don't have enough healthy ones, everything is basically running on empty, forcing your whole system to work way harder. And that's why getting a handle on it is so crucial.
Now, the good news is figuring out if you have anemia isn't some big mystery. It's actually a standard part of prenatal care. You can think of it like some routine detective work that gives your doctor a crystal clear picture of what's happening with your blood.
In this diagnostic pathway, it's pretty straightforward. It all kicks off with a routine blood test, a full blood count, or FBC. From there, doctors zoom in on your hemoglobin level. That's the protein in your red blood cells that does all the heavy lifting of carrying oxygen. Then they take a closer look at the blood picture for more specific clues.
So all those letters, MCV, MCH, MCHC, they're just clues about the size and color of your red blood cells. If those numbers are low, it's a huge pointer toward the most common culprit, iron deficiency. And when they look at the blood picture and see cells that are microcytic and hypochromic, which is just a fancy way of saying they're too small and too pale, well, that's the classic calling card of low iron.
Once there's a diagnosis, there's a really clear playbook for how to handle it. The goal is simple: get the body's balance of healthy red blood cells back on track. So, let's take a look at how that actually works. The path forward really comes down to one big question. How are you feeling? If your blood tests show anemia but you feel totally fine, no symptoms, then the first line of defense is usually oral iron supplements. But if you're actually feeling it, with symptoms like fainting spells, that's a signal that a faster, more powerful response is needed. And that's when a blood transfusion might be on the table.
Now, if you are put on oral iron, there are some pro tips to make it work way better. Taking it with some vitamin C, like a glass of orange juice, seriously boosts how much your body can actually absorb. It's also best to take it on an empty stomach. And a really important point, it's considered totally safe to take even right from the beginning in the first trimester.
And you might be wondering, how do you know if it's actually working? Well, the progress is totally measurable. Doctors aren't just guessing here. With the right oral iron treatment, they expect to see your hemoglobin levels climb by about half a gram to a full gram per deciliter in just 2 weeks. It's a clear sign that you're heading in the right direction.
Okay, so why all the focus on this? Why is managing anemia so incredibly important? Well, the risks for the mother, especially around the time of delivery, are pretty significant. Two of the biggest worries are all about bleeding after the baby is born. The first is something called uterine atony. That's when the uterine muscle is just too weak to contract down the way it's supposed to, which can lead to really dangerous bleeding. That bleeding is called postpartum hemorrhage, or PPH. And because anemia basically starves your muscles of oxygen, it becomes a direct risk factor for this really serious complication. But here's something that might surprise you. A bit of a curveball. While anemia has its risks, it actually does not increase your risk of blood clots. The logic is actually pretty simple. With fewer red blood cells in the mix, your blood is literally less thick, or less viscous, which makes it less likely to form a clot. And of course, it's not just about the mother's health. What's happening with mom has a direct ripple effect on the baby. So let's look at how anemia can impact fetal development. When the baby isn't getting enough oxygen, it can lead to something called fetal growth restriction, where the baby isn't growing as well as it should. In really severe cases, doctors can see signs on an ultrasound of the baby's body trying to cope, like fluid buildup or even an enlarged heart. And on the baby's heart rate monitor, a very specific wave-like pattern called a sinusoidal pattern can show up. That's a huge red flag for doctors that the baby is severely anemic. So it's pretty clear that getting iron levels right is a huge piece of the puzzle. But what happens when the iron supplements just aren't cutting it? Good management means knowing when to peel back another layer and look for other causes. And this is such an important question to ask. Because what if you're doing everything right? You're taking the iron pills, you're eating well, but your numbers just aren't improving. Well, that's when it's time to consider that something else might be going on. One of those somethings?
could be beta thalassemia minor. Now, it's really important to get this next part. This is a genetic trait, not an illness. Someone who carries this trait might just have a mild anemia their whole life. The reason it matters so much in pregnancy is because of the risk to the baby if both parents happen to be carriers.
And thankfully, the detective work here is also very straightforward. If a mother is found to be a carrier, the very next step is simple: screen the father. A quick blood test can check his status, and that gives a clear picture of any potential risk for their child, which allows everyone to plan and prepare.
And, this quote really just sums up the whole philosophy, doesn't it? It's all about being proactive. Whether you're planning for a C-section or just for the incredible physical event of any birth, the goal is always to optimize. Getting those hemoglobin levels into a healthy range beforehand is one of the single best things you can do to lower the risks.
And that really brings us to the final takeaway here. Understanding a risk like maternal anemia isn't about scaring anyone. Not at all. It's about empowerment. It's about giving you the knowledge to take action, to prepare your body, and ultimately to have a healthier and safer journey for you and your baby. Thanks for tuning in.